Okay, so today's we're talking about dental care. In Ayurveda, dental care is also considered as part of your daily routine, and some of the things that you can take into consideration for your dental hygiene. That's what we're going to talk about it today. Now, common dental issues, regardless whether you follow Ayurveda or it doesn't matter, but in general, people have very common issues are with the plaque, gingivitis, cavities, and gum disease. Now, we're talking about today in the Ayurvedic perspective in mind. So obviously, going to talk about preventive care and also some of the things that what you can do at home to keep certain gum disease or even plaque condition at home. You can use some of the remedies. Uh, Dental care, obviously brushing, we all know that. Tongue cleaning, Ayurveda always emphasis on the tongue cleaning as well. Scraping your tongue, of course, in the morning, just remove that white coating that usually gets formed. Uh, Cleaning the tongue also in Ayurveda, it's a good indicator for you to assess that if you have a large amount of white coating on your tongue, that could be an indicator that you probably have some digestion related issues, some amla built up in your system. So cleaning the tongue every day is a good way to assess your own body. Okay. Many times if you will notice it if as you start cleaning your tongue every day and paying attention to the white coating that gets formed on your tongue. If you don't have that, then that means it's good. If you don't have any cracks on your tongue, that's also a great thing. But if you do notice a white coating and if you consistently seeing that it's just not going away, it indicates that there's something you need to address at the digestion level. A lot of times when there's a lot of amla built up in your system, it will also show up on your tongue. So when you go to the Ayurvedic practitioner, tongue is one of the assessment tools that they use to understand what's going inside your body. Now, keeping your dental care in mind, of course, brushing, tongue cleaning, oil pulling. I'm going to talk a little bit more about it. What is oil pulling? Gargling with herbal decoctions. We'll talk about that also, what we can do with some of the easily available herbs to use that for your oral care. And some of the herbs that you can take internally as well as externally. So oil pulling is it's a concept where it's you keeping the oil in your mouth and squishing it around. So the ideal time to do it is in the morning before you brush your teeth. You can use sesame oil, coconut oil, sunflower oil. Ideal oil to use is sesame oil because it's a lightness and it has a slightly heating potency. And if you're looking for something cooler, then coconut oil is also a best alternative as well. Sunflower oil is sometimes it's just easily available and it's ready, but preference would be to sesame or coconut oil. The way you will do oil pulling is basically taking about a couple of teaspoons of oil in your mouth. Literally, you're just taking this teaspoon. If you prefer warm, you can obviously warm up your sesame oil. Coconut oil, you don't need to because as soon as you put it in your mouth, with the heat of your mouth, it will start to melt. So you really don't need to heat up the oil. But it's a preference. If you feel that you want a slightly warmer oil, you can go with, again, warming it up on your candle warmer or however you have easily available tools at your hand. Swishing the oil in the mouth and you holding the oil in for a few seconds and then again you're pulling the oil to the mouth. So it's just basically squishing it around in your mouth, holding it, squishing it around, doing this for about 3 to 5 minutes. And by the benefits of oil pulling is it's, again, not just for maintenance of your dental health, but it also helps if you have any plaque buildup. A lot of time, just the overall cleansing, overall deep cleansing of your teeth, it really helps. It removes a lot of bacteria, it removes a lot of those sludge that gets, collected between your teeth, and it helps with the gums. For the healthy gum, it's a great way to, great remedy for that. Sometimes even migraine. People, if you have a migraine, oil pulling also helps with the migraine too. It's in a way, think of that way as like massaging your internal, in your mouth, in your oral care. So it has a lot of benefit as well, not just for your dental and oral care, but even it helps with your jaws. If you have, many times people are stressed, they're clenching their jaws in sleep. and then there's a lot of tightness in your jaws, and then you are grinding your teeth at night, obviously. So oil pulling helps loosen up those joints, and it helps with that uh, relaxation. So there are many benefits to it, and it's a great way to do this. After you do your oil pulling, again, you can just spit it out, the oil. Do not swallow it because it has a lot of obviously toxic and bacteria in it. And rinse your mouth with the warm water about 3 to 5 times, and then you can just brush your teeth. This is the Ayurvedic guidelines that brushing the teeth, but I've heard many people prefer to actually brush their teeth first and then do the oil pulling. So you can do that also. There is really the benefits are in both ways. There are great benefits. So it's your personal preference, more for like what works best for you. So this is oil pulling. And then again, just like any oils, if you are concerned about discarding the oil down your drain, then obviously you probably need to use something else to spit out your oil collect in something else, and then just discard it the way you would discard the cooking oil if it's of your concern. But again, do not use any oils if you're allergic to it, even if you think it's just you're not ingesting it and you're still putting it in your mouth, but you should not use any oil that you may be allergic to it. Obviously, don't swallow it. And then there are a lot of medicated oils available as well, but these are, again, we're talking with easily available oils at your dispense, easily that you can use on a daily basis. Now, oil pulling can be done daily, or you can do it on a weekly as part of your weekly routine as well. Herbal decoction. So the herbal decoction is also, it has a great same benefits. It helps you with your gum disease if you have inflamed, if you have discharge from your gums, if you have that soreness in your gums. It's a great way to mitigate that using the herbal decoction. The way you will make herbal decoction is you can use any one of these common herbs, Amla, Trifla, Yastimadu. Yastimadu is a licorice root powder. Again, we had talked about it before. It's available at Indian grocery stores that I've seen. You can take about half a teaspoon of any of these herbs, add a little hot water to it, about 2 or 3 teaspoons, and let it sit for a little while. And then when it cools down, you can do the exact same thing like you would do with the oil pulling. You're putting it in your mouth, you're squishing it around, you're holding the liquid, again, squishing it around, and then you can just spit out that liquid. And then you can just rinse your mouth. So benefits of herbal decoction is, again, like I said, it's not just for your oral hygiene, but actually if you're trying to treat any of the gum conditions, it's a great way to use that tool for your overall gum health. Some of the internal herbs you can take, Amla. Amla is a great way to use in many ways. You can take it in a juice, you can take it in a powder form. There are Amla pills available. Those pills and juice form, again, it's recommended if you are really working with gum issues, like people with age-related. Sometimes they have receding gum lines, and sometimes they have a lot of those dentures if they're wearing. Gum gets inflamed. And if you're working with those situations or those conditions, taking Amla internally helps as well. Again, you have to kind of take a precaution in your mind that you don't have any other underlying medical condition. And if you have taken Amla before, and if there are no side effects for you, it's a great tool. The only side effects you want to keep in mind with Amla is somebody with hyperacidity. You want to just kind of adjust your dosage accordingly if you do decide to take Amla internally. But you can, again, doing the decoction has the same benefits. But if you're working towards regenerating your gum health, basically building your gum tissues, then taking internal Amla is advised for that. External use, same thing, licorice root, that's the Yastimadu. Yastimadu is also used for internal as well, but for this particular session for the dental care, I am not recommending, obviously, taking it as internally, because with the Yastimadu, you also have to keep in mind what other health conditions you have in mind. So if you're working with an Ayurvedic practitioner, he or she may prescribe licorice root internally as well. But for just a very general maintenance, preventive care purpose, I would recommend to use that as an external only, not to take it internally. Same formula again, about half a teaspoon of powder with half a cup of warm water, and you can use that as a mouthwash also. So this is a great way if you have some dental work done, and if you have a toothache, if you have, again, if you have cavities and if they're hurting you, you can definitely do this decoction as well, and it will help ease the pain, and it will help soothe the gums as well. So the cautious with the Yesti Madhu is, again, because if it has a sugar content, so people with diabetic, you want to make sure you're not ingesting that. Again, it's very safe. There is no harm in it, even if you ingest it a little bit of, but it's okay. But just to give you an idea that you keep it as a more for external use only. It has great antibacterial effect as well. So it's a great way to use on a weekly basis or even daily basis as your nightly mouthwash. You can use that also. So this kind of concludes our dental care session today.